Understanding involuntary body movements, a comprehensive medical guide when our bodies move without our conscious control. Medical professionals refer to these as involuntary movements. These uncontrolled motions, which can significantly impact daily life, manifest in various ways, from brief muscle twitches to sustained tremors or seizures. While some individuals might experience these movements as mere inconveniences, for others, they can represent significant medical challenges that affect their ability to perform routine tasks, maintain social interactions, or even manage self-care activities. Understanding the spectrum of involuntary movements can affect any part of the body, particularly the face, neck, or limbs, and their duration varies significantly. Some may be fleeting occurrences while others could persist and intensify over time. The complexity of these movements ranges from simple muscle twitches to elaborate, uncontrolled motor patterns that can involve multiple muscle groups simultaneously. The impact on quality of life varies similarly, with some individuals experiencing minimal disruption while others require substantial lifestyle modifications to accommodate their symptoms. Categories and clinical presentations. Tardive dyskinesia, TD, a neurological condition typically associated with neuroleptic medication use, primarily affects facial movements. The condition often develops as a side effect of long-term use of medications designed to treat psychiatric disorders. Individuals with TD frequently experience uncontrolled facial expressions, including excessive blinking, tongue protrusion, and various lip movements such as smacking or puckering. The social implications of TD can be significant, as these visible symptoms may affect social interactions and self-esteem. Recent advances in treatment options have provided new hope for individuals managing this challenging condition. Tremors represent another common form of involuntary movement, characterized by rhythmic muscle contractions. These movements can be classified into different categories based on their presentation: resting tremors, occurring when muscles are relaxed; action tremors, happening during voluntary muscle movement; and postural tremors, appearing when maintaining a position against gravity. While most people might experience tremors due to everyday factors like exhaustion, anxiety, or low blood sugar levels, they can also signal more serious conditions such as multiple sclerosis or Parkinson's disease. Understanding the specific characteristics of tremors helps healthcare providers determine their underlying cause and appropriate treatment approach. Myoclonus presents as sudden, shock-like jerking movements that can affect any muscle group. While these movements naturally occur during sleep or in startled responses, they might also indicate underlying conditions like epilepsy or Alzheimer's disease. Physiological myoclonus, such as hiccups or sleep starts, is generally harmless. However, pathological myoclonus may significantly impact daily activities and require medical intervention. The severity and frequency of myoclonic jerks can vary greatly among individuals, ranging from mild, occasional movements to severe, frequent jerks that interfere with normal movement and coordination. Tics, another distinct category, involve sudden, repetitive movements that can be either motor-based or vocal. These movements range from simple actions like shoulder shrugging to complex behaviors involving multiple muscle groups. Tics often have a premonitory urge, a sensation that precedes the movement, and many individuals report a temporary sense of relief after performing the tic. While commonly associated with conditions like Tourette syndrome, tics can also appear in other neurological conditions or as temporary phenomena during childhood development. Athetosis, characterized by slow, writhing movements, primarily affects the hands and arms. This condition, like many involuntary movements, often indicates underlying neurological issues affecting motor coordination. The movements associated with athetosis are typically slow and continuous, creating a writhing or snake-like appearance. This condition frequently occurs in conjunction with other movement disorders and may be particularly challenging to manage due to its continuous nature. Underlying causes and risk factors. The etiology of involuntary movements varies significantly between children and adults. In children, conditions like hypoxia and cerebral palsy commonly trigger these movements. Developmental disorders, genetic conditions, and early childhood injuries can also lead to various forms of involuntary movements. The timing of symptom onset often provides valuable diagnostic clues, as certain conditions typically manifest during specific developmental stages. Adults might experience involuntary movements due to various factors, including medication side effects, brain injuries, strokes, or degenerative disorders like Parkinson's disease. The adult onset of involuntary movements often requires careful medical evaluation, as it may signal underlying neurological conditions that require prompt treatment. Age-related changes in the nervous system can also contribute to the development or worsening of involuntary movements. Medication-induced movement disorders. Numerous medications can trigger involuntary movements as side effects. Neuroleptics, commonly prescribed for psychiatric conditions, represent the most frequent pharmaceutical cause. These medications, while essential for managing various mental health conditions, can affect the brain's motor control systems, leading to movement disorders. The risk often increases with higher doses and longer duration of use, though individual susceptibility varies significantly. Other medications that might induce these movements include antidepressants, anticonvulsants, and even common medications like antihistamines and decongestants. The mechanism by which these medications cause movement disorders varies, but often involves their effects on neurotransmitter systems in the brain. Understanding these medication-related risks helps healthcare providers balance the benefits of necessary treatments against the potential development of movement disorders. Diagnostic approaches and evaluation. Medical professionals employ various diagnostic approaches when evaluating involuntary movements. The process typically begins with a thorough medical history review and detailed questions about the nature, frequency, and impact of the movements. Physicians pay particular attention to the pattern of movement, triggering factors, and associated symptoms, as these details often provide crucial diagnostic clues. Advanced diagnostic testing might include comprehensive blood work to check for metabolic disorders, autoimmune conditions, or toxic exposures. Imaging studies like MRI or CT scans help identify structural abnormalities or evidence of past injuries that might contribute to the movements. Specialized tests such as electroencephalograms can provide information about brain activity patterns associated with the movements. Treatment strategies and management approaches. Treatment strategies vary depending on the underlying cause and severity of the movements. Healthcare providers might prescribe specific medications like anti-epileptic drugs for certain conditions, while others might require adjustments to existing medication regimens. The choice of treatment often depends on various factors, including the type and severity of movements, overall health status, and potential side effects of different interventions. Physical activity plays a crucial role in treatment, with activities like swimming, stretching, and walking potentially helping to enhance coordination and maintain muscle function. These activities must be carefully tailored to each individual's abilities and limitations. Physical therapy and occupational therapy often provide valuable support in developing appropriate exercise programs and strategies for managing daily activities. The role of support systems. Support groups can provide valuable assistance for individuals dealing with involuntary movements, offering both practical advice and emotional support. These groups often serve as important resources for sharing coping strategies, understanding new treatment options, and building connections with others facing similar challenges. Medical professionals can often help connect patients with appropriate support networks. Living with involuntary movements. For anyone experiencing recurring involuntary movements, seeking medical evaluation is crucial. While some instances might be temporary and benign, others could indicate serious underlying conditions requiring prompt medical attention. Early diagnosis and treatment often lead to better outcomes and improved quality of life for those affected by these conditions. Managing daily life with involuntary movements often requires adaptations and coping strategies. These might include modifications to work environments, use of assistive devices, or development of new techniques for performing routine tasks. With appropriate medical care, support, and management strategies, many individuals with involuntary movements can maintain active and fulfilling lives while effectively managing their symptoms.